Hello, and welcome to the Aging Answers podcast. I'm Rob Faubion with Age of Central Texas. We're a regional nonprofit organization that helps older adults and family caregivers. Every month, we bring you our Aging Answers podcast to bring you experts in the field of aging to help you in your journey. Our Aging Answers podcast is brought to you by HEB because no store does more for older adults and family caregivers in Central Texas than my HEB.
You know HEB for quality fresh food at low prices to help you eat well. Now, HEB has primary care physicians and dietitians on staff to help you get and stay well. And because HEB believes affordable care should be accessible to all Texans, monthly memberships and cash payment options are available. Let HEB's team of highly reputable and experienced care providers help you on your health journey. Virtual and in-office visits are available. Visit heb.com/wellness to learn more today.
One of AGE's programs that we're very proud of are our Thrive Social and Wellness Centers. They are adult day health care for older adults who are unable to stay at home by themselves during the weekday. And one of the wonderful things about our Thrive Centers is not only does it benefit the older adult, but it also has many great benefits for the care partner. So joining us today is Holly Stoever. She is our Program Director for our Williamson County Thrive Social and Wellness Center. Good morning, Holly.
Good morning. Thank you for having me.
And thank you so much for joining us with your expertise. Let's back up here just a minute and let's talk about exactly what is adult day health care, because I think it's probably a concept that not many people are aware of.
Yes, I like to say that we're one of the best kept secrets around, unfortunately, as I hope that everybody, or I wish that everybody would know about us. So an adult day center is essentially a place for older adults to come with a variety of different diagnoses and for a variety of different reasons, whether that is to get socialization, if it's to make sure that their care partner can go to work without worrying, but we provide a bunch of different activities, meal times, and we allow for a place for older adults to socialize and be a part of a community.
What's so wonderful about our centers is that they are designed like a social club. And so for our members who are coming to our Thrive Centers, they're coming to their social club for the day.
Exactly. That's a big phrase that we like to use.
But the reality is it is a licensed with the state medical model adult day health center. So explain a little bit what that means.
So we have a full-time nurse on staff here Monday through Friday that can help monitor health needs, make sure that medications get administered. If something happens during the day, we're there to be able to provide services. And we're here to make sure that they are interacting in the environment safely and that all of their needs are being met.
And of course, our staff are trained in dementia care as well.
Mm-hmm.
And so for our members, it's their great place that they get to come spend the day, be with other older adults, have a fulfilling active day, and be able to go back home at the end of the day, wherever home is for them. And then for our family caregivers, they know that mom, dad, husband, wife are somewhere safe, secure, being cared for by experts in the field, and allows them the opportunity to, as you said, whatever they need to do for their day. So we know that in order to slow cognitive decline, our big three are eat well, stay socially active, and stay physically active. And those are all three things that we do every day at our Thrive Centers, aren't they?
100%. Okay, continue. Sorry.
I was just going to say, talk us through what a typical day looks like at a Thrive Center so we can kind of get a picture in our head of what it's like to attend.
100%. So our hours of operation are 7 a.m. to 5:30 p.m. We do have some members that are here at 7. Although that is not required, you can show up anytime that works with your schedule. And the days start with good music. Usually we're providing multiple different things that are on TV. Sometimes it's virtual hikes, sometimes it's walks through certain cities that we get to talk about as we drink our coffee and socialize with our peers, or color as we get ready for everybody else to start showing up. Usually around 9:30 is when we have our biggest group of people that will come because that is our first meal time. We serve our breakfast there. For example, this morning we had hard-boiled eggs, toast, applesauce, milk, water. So a nice full breakfast. Then we start with our first activity of the day, which is our daily chronicle. And it goes through things that have happened in history on that day, what special days that is, someone's birthday, some trivia, and it usually provides some really great conversation starters for us to all interact as a group and be able to reminisce or talk about some weird stuff that we heard in it that day. And then we go into the big bulk of our day. Usually we start out with exercise. We usually do 30 minutes to an hour of exercise every day. It is seated. Mostly, sometimes it's walking around and dancing and getting to have a good dance party in there, but it provides a very solid workout, gets some good stretching in. Then we have our lunch, which is at 11:30. We give about an hour for that so people can eat at a timely manner, make sure that they get to enjoy it in the way. And at 12:30 is when our next activity starts. It kind of depends. Sometimes we have vendors come in and do live music for us or a presentation. Bingo is always a staple and always enjoyable. We also do a multitude of other different games as well, Family Feud and Jeopardy. And sometimes too, it's crafts or things that are around the theme of that day. And then we do a couple of other ones. Our snack time is at 1:30. We do another activity after that, kind of varies of what that will be. At 2 o'clock, our bus leaves, and then we get to kind of start winding down for the day after our 2 o'clock activity. And everybody is socializing, talking with one another. We go out into the garden almost every day to make sure we water and take care of the things that we have there. And then people start heading home.
So you mentioned the bus, and I think most people don't realize we can provide transportation options for folks to be able to attend the Thrive Center.
We most certainly can and do. We try our best to accommodate the needs for everybody. We want people to be able to access our services.
And you also mentioned our gardens. Our Thrive Centers all have beautiful gardens with them. And we have master gardeners that come in and help us garden. So we're growing vegetables and herbs, and we actually harvest those and cook with them and send them home with our members.
Yes, we do. And all of our gardens are raised. All of the beds are raised so that people can access them way easier than having to bend down and pick things. So very, very helpful.
And one thing I did not mention, but we keep alluding to, is that we have more than one center. So we have our Williamson County Thrive Center, which is in Round Rock, and it serves the northern parts and eastern west northern parts of Central Texas. We have our Austin Thrive Center, which is in the center of Austin, and we have a brand new one under construction that will be opening summer of 2023 that will be down south in the South Park Meadows area of Austin that will be able to serve all of South Austin into Bastrop and Hayes County and all of those areas. So we are really extending our reach of the services that we are providing throughout Central Texas.
I know, it's so exciting.
It is incredibly exciting. And as you mentioned, every day is different at our Thrive Centers. Every day is unique because we have a full-time activity director in addition to having our full-time nurse and our program specialists that provide care during the day. We have a full-time activity director that plans a different day every day.
Yes, plans a different day with details and make sure that we're hitting all the special parts. If it's a special day or a holiday, we plan a party. We really do our best to provide structure, but with being able to provide enough change and enough things where it doesn't get monotonous. And it is, it really is an incredible thing that we can be able to provide so many different things within a day or from day to day.
And you know, that structure is very important, especially for those who are living with cognitive decline. Having that daily structure of knowing that every day I'm having breakfast at this time I'm going to have exercise, at this time I have lunch, I have my art project during this time, but not having it being repetitious and boring is really wonderful. And you know, that structure is also very helpful for our family caregivers. Let's segue here because The Thrive Social and Wellness Centers really are a win-win. It's a win for the older adult because it gives them the socialization, it gives them a place to be during the day, it gives them purpose in their life, and in many ways gives them back dignity because there is so much choice involved in during their daily involvement. But for the family caregiver, it really helps them because it gives them that respite that is so important. So let's start number one. Let's talk about what is respite and why is that so important for a caregiver?
Respite is essentially time where a caregiver is not having to spend time providing that care. That can be having someone come by the house and hang out with their loved one, or if it's bringing someone to a facility, there are certain nursing homes that do provide respite care for people so that they can go on vacation without having to have worry. But a big part of respite, and that's why the Thrive Centers are here, is adult day centers. It is a place where you can bring your loved one during the day, where you can work, you can do the errands that you need to do, or you can just rest without having to worry about the safety of your loved one. And it does wonders for mental health. It also keeps you on top of the things that you need to do in your life and makes you able to provide that care for your loved one.
You know, that is so important. We, as caregivers, we have to recharge our batteries. I've mentioned many times in these podcasts, I'm a caregiver myself. I care for my parents, and having that time to just take care of Rob is essential because we can't afford to go down. You know, if something happens to me, if I wear myself out, if I become sick, if I just burn out in this process, who's going to take care of my mom and dad? And so we have to be looking out for ourselves. And it's not being selfish, it's being realistic. And one of the great things about the Thrive Social and Wellness Centers is it gives a caregiver that opportunity because they know their loved one is somewhere safe, secure, and that they're having a wonderful day. And I don't have to worry about them. I'll go do what I need to do. I'll go to work. I'll go to the grocery store. I'll go to the park and feed the ducks. I will binge on Netflix, whatever I need to recharge me. That's a great opportunity. Let's talk a little bit about the caregiver burnout because it is very real. You know, we know that approximately 40% of our population are caring for another person. And we also know that caregiving is not a sprint, it's a marathon. You know, it's not something that happens for just a short time. It's something that happens for an elongated time, and we have to plan for that. And we see a lot of caregivers who do burn out because they just don't have the resources, they don't have family support, they don't have a community around them to help them with this burden. And we hate to use the word burden when it comes to caregiving, but sometimes it feels that way. And so this is a great opportunity to help prevent that burnout, or if you're already feeling that burnout, to give you the spark to get back to the wonderful part of your journey.
Exactly. What Blue Cross Blue Shield did a survey and a study with 6.7 million different care partners and caregivers. And they said 57% of those caregivers are feeling high levels of stress and anxiety and or depression. So caregiver burnout is incredibly real. And I hear real stories all the time about all the different obstacles that people are having to go through to make sure that their loved one gets what they need, but also so that they can have their life too and make sure their needs are met. And that's why I'm so lucky and so happy to be in this position, is because I can see the changes that are made once their loved one starts attending. They are able to do things. They come to me with smiles and say, I got through this stack of papers that had been on my desk for months, and I feel so much better. It truly does allow for that time to recharge your batteries. And just like you said, Rob, caregivers are constantly pushing themselves to the side, saying, nope, I got to keep going. If I don't do this, then mom's going to suffer. I won't be able to get this done. It's like we're pushing ourselves 100 miles a minute. And it doesn't get us where we need to go. And it isn't selfish, it's realistic. When you look at yourself and you say, I need this time to be able to get done whatever it is. And like you said, if that is binging Netflix, great, do it. Take the time that you need to make sure that you're at the place where you can provide that care for your loved one and be healthy.
Yeah, we talk about isolation, and it's at pandemic levels for older adults, but it's also at pandemic levels for caregivers, because caregiving can be very isolating. We give up a lot in order to spend more time with our loved ones, and we give up time with our friends. We give up our hobbies. We give up those things that brought us joy, and being able to recapture those takes time. And being able to buy that time back by having someone else professionally take care of our loved one is a huge thing for a caregiver.
It's so huge. I was in an assessment a couple of months ago, and the wife was bringing her husband, and as I was speaking with her, she was like, I'm so excited. She was like, we moved here 3 years ago, which was right at peak pandemic time. So they did not have an opportunity to meet or make any friends. And she was like, I'm going to try to find a hobby. I'm going to see if I can make some friends. And I was so incredibly excited and happy for her. And too, her husband was getting a totally different type of engagement than he was getting at home, getting different types of interaction. And it's proved to be a great win-win. She started playing pickleball and she's very happy. So it's stories like that and things like that that really go such a long way and show the true win-win of what day centers can be, what respite is.
And also, there's another win-win that we don't often see, that we don't often talk about, but we do see. And that is that we see our loved ones who are living with that cognitive issue start to blossom quite a bit, because they're getting that interaction every day. They're getting that socialization. They're not just sitting at home staring at a television. Okay. And so we have so many stories of how the loved one has maybe taken a little bit of a step back from their cognitive decline and surprised the family in how they become more engaged. And so, it's kind of ephemeral in being able to prove that. But one of my favorite stories is one of our members in the Austin Center who was originally from Korea. And she had regressed to a point where she was only speaking Korean because that's what they spoke when she was a child. But her children did not speak Korean. And so there was that gap in being able to communicate. Within just a few weeks of being at the Thrive Center, she started regaining some of her English language, and the family was just amazed. They're like, we have mom back again. And we have so many stories like that of people who were almost basically catatonic when they start, and suddenly they're dancing at the dance parties and they're doing art projects. And when their loved one comes to pick them up, they tell them about their day, and so many wonderful things like that.
Incredible. There was one member when I was working in the Austin Center that started, and he was having such issues being able to walk and move, and he was so shy, didn't want to participate in anything, was really trying to push himself back. And slowly but surely, we kind of opened up that shell, and oh my gosh, I would say like a month later, he was walking better. He was participating in everything. He was making friends. He was telling us all these stories. We were getting to share stories with his family, who were shocked to hear that, yes, he danced for pretty much an entire hour because he did not want to sit down. He was so excited about it. He's making all of these friends. I mean, the success stories and the changes that it can make in a person is incredible to witness and view.
It really is. And it's not rocket scientist. It's just providing that opportunity for someone to regain their purpose in life and to give the caregiver that break they need so they can catch their breath as well. So let's talk about what it takes to become a member of our Thrive Centers. What is the process for enrollment within our centers?
Wonderful question. So Typically what it starts at is after the first point of contact, whether that be a phone call or an email, I send an email, or my staff does, to the care partner that has more information about a program, and also has a link to an eligibility form. That eligibility form is what gets the whole ball rolling, so to speak, for our process. It just asks some basic questions: contact information, level of care questions, behavioral questions, and it does have a spot for physicians information, and that is very important, because our next step is to reach out to the physician listed and obtain doctor's orders. The doctor's orders are nothing crazy. It is standing orders, which gives us permission to administer Tylenol or bandage a cut if needed, a list of medications, and the last part is a list of diagnoses and if any special diet needs to be followed while they're here. After we obtain the doctor's orders, then I'd reach out to the family and we'd schedule an assessment where they would come in and meet with me, my activity director, and my nurse. The assessment takes about an hour and a half. After that, then the potential member has the opportunity to stay for a trial day, either the same day of the assessment, or we could schedule it for another day so that they can try us out. We make sure we're a good fit for each other. After all of that, then they'd be able to get started at the schedule that we agree upon during the assessment.
And, the doctor's orders are simply because we are a medical model adult day health center. And so we're taking care of that person during the day. And so we need to know what we need to know in order to care for them fully. One of the great things, though, is because we do have a full-time nurse, is that our nurse communicates with our members' doctors and with their healthcare, and vice versa. So we might see improvement in things that we can report to the doctor, or sometimes we see some decline that we might want to alert the doctor about. So we're another set of eyes for that family, and to help to provide better care for their loved ones. So I think that's something that is really important that a lot of people don't realize, that it's another benefit of the Adult Day Health Center.
Yes, and that's why we like to use the word care partner here, is because we really do look at it as though we are partners in the care of your loved one. We're sharing information back and forth to make sure that they're getting what they need, to see if we can provide the families with resources, if they have questions or if obstacles come up. We're working very closely together, and that does also, just like you said, Rob, include the physicians too. If we notice changes, if there's anything like that that pops up, we are on top of it. We're here to try to make sure that our members are living the best life that they can be.
And that's so true. We want to make sure that everybody lives their best life. And, the Thrive Centers are just one of the programs offered by Age of Central Texas. And we like to provide that wraparound service for the family. So in addition to being able to attend the Thrive Centers, we also offer our members support, such as our health equipment lending. If anybody needs durable medical equipment to keep them safe and mobile, we give it away for free. But especially for our caregivers, we provide support groups, and we have conferences, and we have our resource center where they can get one-on-one assistance. And so part of that initial assessment is also kind of feeling out, what else can we help you with?
Exactly. That's actually one of my favorite parts in the assessment, is going over what all of our different programs are, and being able to see the faces of the care partners who didn't know the full realm that age covers. That information and resource center goes such a long way, as does our help office, the medical equipment, and Caregiver U and the support groups. It's total care. It's total resources. You get to hop onto any part that you think would be helpful for you, learn about all these different things, because very few people are growing up thinking that they're going to be a caregiver or that they're going to be put into this situation. It's something that very few people plan for, and usually when they are a caregiver, they're learning at the same time. It's very overwhelming. So being able to provide so many different services to make it feel more doable and that they do have that support is such an amazing thing.
That is such a tremendous point, because as caregivers, you're right, nobody taught us how to do this. And, our journey changes constantly. And so we're always coming up against a new obstacle, and we're not really sure where to look to find the assistance, the resource, and knowing that I can just turn to my partner here at Age and be able to say, hey, this happened and I don't know what to do, and be able to get an immediate answer of, oh, that's easy. Here's what you do. Here's who you call. Here's your resource, is just life-changing, because you know that you can keep going. And for so many caregivers, that's why they burn out, is they keep hitting their head against the wall because their journey is changing and they don't know what to do. And so having partners like Age and the Thrive Centers and all of the resources are just so important. Let's talk about two more things. One, is there anything that would keep a person from being able to attend the Thrive Centers? Are there any obstacles that might be in a person's life that this might not be a great fit?
It's a great question. So we are a social center, so we do operate as a group, and making sure that we can still be able to provide our activities to the greater group is very important. So if there's behavior that is very disruptive, that is not redirectable or manageable with the staff that we have in place, that would definitely be one of them. We cannot do two-person assists, so that would be two-person transfers in the bathroom or to get from one to another. We need them, we ask for our members to be able to bear some weight to help that transfer be able to be done with one person. And extensive one-on-one needs. Because we are a group setting, our ratio is 8-to-1. We do not have enough staff for them to be placed with the member all day or for long periods of time, because we do need to make sure that we can provide care to the greater group as well. So just making sure that people can be able to work within a group setting, I think, is one of the most important things. And I will say this too, we are aware that there is a transition. It is a big change for somebody to come into a group setting after being home for however long that might be and only seeing their family. It's a total environmental change. And there's some behaviors that might be present in the beginning that won't be present as they get used to things. So we do work with families, we work with people, we want to provide services. And if we aren't a good fit, like we've mentioned, Age has a lot of different resources that we can do to help you try to find the fit that would work best for you.
Yeah, no program, no service is going to be a one size fits all, but our Thrive Centers are a one size fits most, because over all of the years that we have operated our centers, we have dealt with just about everything. So we have experience in members who use feeding tubes. We have some members that are close to catatonic at times. And the wonderful thing about our centers is that we meet each member where they are. And we do provide that individualized support to them in the greater group setting. So nobody is going to be left out of anything that happens. We can handle pretty much everything. But there will come a time when this is no longer a good fit, because our journey will progress to a point where maybe we need to talk about long-term care. We need to talk about assisted living. We need to talk about memory care, that it might not be, this is a great fit. But in the meantime, this is a tremendous opportunity to give the member, give that loved one something that they can do during the day, give them their purpose, give them their dignity. Number two, to give the caregiver that respite that they need, along with the support in their journey that they need. And number three, it is such a tremendous opportunity to help slow some of that cognitive and physical decline, so that we can keep them with us at home longer, and we are not having to look immediately at assisted living and memory care. We've had some members that have been with us 10 years plus that probably would have been in a nursing community many years prior if they had not been spending the time with us.
Exactly. We have one member here who's been here 12 years.
And we also want to point out that even though we serve older adults, that is our mission, we do not have an age limit on who we serve. And so we have some members who are well over 100 years old, and we have some that are in their 40s and 50s because they have started their cognitive decline very early due to multiple circumstances. So we want you to understand that we are not just talking about people who are in their 70s and 80s as who we only serve, but that is our area of expertise is in dementia, and it typically happens later in life, but we are not going to turn someone away because of it, their age.
Exactly. And to diagnoses, as you said, our main is dementia, as most of our members have some form, but some are aging normally. Some have a variety of other diagnoses. That does not disqualify anybody. It is a place to come and socialize. Make sure that you have the care that you need. Make sure that you have that community, and making sure that the families get that rest too. So it's not discriminatory based off age or based off diagnoses or anything to that point.
And it's the same with all of our programs. All of our programs are open to anybody of any age because, let's face it, we're all getting older. So we want you to understand that we are here to help you wherever you are in that journey, whether you're an older adult or a family caregiver. We have the programs and resources. One final question for those who think, oh, this would be wonderful, but I don't think my mom, dad, husband, wife would ever go. Can they schedule a time just to come to visit, to kind of check it out?
Yes, most definitely. I think tours are a great thing. You can give a call to either one of our centers. We'd be more than happy to set up a time for you and your loved one to come, or for you to come. I've done it in many different ways. Sometimes it'll be the care partner that comes first, and then they say, yep, this is good. I can bring mom to this or dad to this. And then they come and do another tour, and then they come for the assessment and get through all of that. So however it works, we're more than happy to open that door, and we're more than happy to work with you. We want success too. We want you to be able to start a program as well.
And as you mentioned, this is an emotional thing. As a caregiver, changing the routine like this is emotional. It's akin to sending our child off to the first day of school. And so it's emotional for both sides, both for the members, they join something new and have a new social group to be with, and for the caregiver, because this is what I have done for the past however many years the same way, and now you're going to give me some time back? I don't know what to do with that. So it can be a little bit scary in here, but it's such a wonderful thing, as you mentioned, that people start and they're like, I'm not so sure about this, and within a day, 2 days, they're like, why didn't I do this sooner? This is just so amazing. I'm having such a good time coming to this place and doing the art projects and getting to have fun and dance parties and all that. And the caregiver's like, yeah, I got to go sit out in the park and watch the wildflowers. It was awesome. So it has so many great benefits and win-wins to it. Thank you so much, Holly, for helping walk us through this, because as we mentioned, adult day healthcare is something that not very many people know about. And that's why AGE has been for so many years the only provider of it here in Central Texas, because it's a concept most people are not aware of. Yet it's such a robust opportunity, both for our older family members and for caregivers, to help us in so many ways in this journey. So thank you so much for spending the time with us. We appreciate it.
Thank you, Rob. It was a pleasure being here. Thank you for having me.
And we thank you for watching our Aging Answers podcast. Remember that we are here at Age of Central Texas to assist you no matter where you are in your journey. And as I always say, please remember, there is never any shame in asking for help. As we mentioned today, nobody taught us how to do these things. And so that's why organizations like Age of Central Texas are here, to provide you with the knowledge, with the programs, the assistance, the shoulder to cry on, whatever you need to help you be successful in your journey, both as you age and as you caregive. So let us know if we can be of more service to you. We hope that you have a wonderful day. And remember, we bring you a brand new Aging Answers podcast every month right here on our YouTube channel. Have a wonderful rest of your day.